Are you experiencing excessive hair loss post-COVID? Trust me, you are not the only one. We are receiving similar complaints from so many of our patients these days. Hello everyone, I am Dr. Parmil Kumar Sharma, a consultant dermatologist and hair transplant specialist at Clinic Skin Essence in New Delhi. Before we discuss about post-COVID hair loss, I'd like to tell you about what is hair loss and what are its causes. So let's understand hair loss. We can call it alopecia in medical language. So hair loss, it can occur in men, it can also occur in women, and it can occur even in children. So to prevent this condition, one should take good healthy diet, should maintain stress levels, a good hair hygiene and good overall health. So an individual usually loses 50 to 100 strands of hair daily. This is due to normal hair growth cycle. When one loses more than 50 to 100 strands daily, then it is a matter of concern and he or she should visit to a dermatologist or hair specialist. So now coming to hair cycle. What is normal hair growth cycle? So hair cycle, it consists of 4 phases. Number 1, anagen phase. We call it as hair growth phase. In this phase, hair attains its normal thickness, its color and its length. This phase usually lasts for 2 to 8 years. Second, catagen phase. In this phase, hair stops growing. It separates from the other growing hairs and this phase usually lasts for 10 days. Third phase, telogen phase. This we call as a resting phase. Hair comes to a rest and this phase usually lasts for 3 months. At the end of this resting phase, there comes a phase, kinogen phase, and this is the phase of active shedding of the hair. The new hair follicle starts growing and sheds the old follicle from its hair. So this is normal hair growth cycle. When there is interruption in this normal hair growth cycle, hair fall increases or hair thinning starts. Now what are the factors responsible for disruption in this natural hair growth cycle? Number 1, heredity. Heredity is one of the most common causes of baldness. If someone is having a family history of baldness, then he or she is most likely to experience baldness or hair loss with age. Second, hormonal imbalance. Hormonal imbalance during pregnancy, childbirth and menopause. It can cause permanent or temporary hair loss. Number 3, aging. With progressive aging, hair follicle stops producing new hair or the growth of hair slows down with time. Number 4, medical conditions. Certain medical conditions like autoimmune diseases, PCOS, psoriasis and dandruff, they can cause hair loss. And nowadays, patients are complaining of excessive hair loss post-COVID. So what are the factors responsible for excessive hair loss during this post-COVID phase? Weak immunity and nutritional deficiency which occurs during COVID is responsible for excessive hair loss during post-COVID phase. This post-COVID hair loss is reversible and this is a good news for you. Number 5, side effect of certain medications. Certain medications like acne medicines, antifungal medicines and antidepressant medications, they also can cause hair loss. Since causes vary from one person to another, treatment will also vary from one person to another. And to give you desired results, we have to make a proper diagnosis. And it depends upon the symptoms patients usually face during hair loss. Now, what are the symptoms of hair loss? First, hair thinning. Second, receding hairline. Third, baldness in the frontal area or in the crown area. Fourth, hair loss patches anywhere on the scalp. Fifth, full body hair loss. So, hair fall is a condition that can seriously affect patient's self-confidence and appearance. But with various treatments available, we can improve almost any kind of hair loss. So now what are the various treatments available? First, growth factor therapy. It is also called as PRP. That means platelet rich plasma therapy. In this, we uses patient's own blood and we extract growth factors from this, and then we inject these growth factors into the roots of the hairs. So what this PRP does, how it helps in controlling hair loss? It improves the blood circulation in your hair follicles and it provides essential nutrition that is required for hair growth. Now, second treatment is mesotherapy. This is one of the commonly performed treatment in hair loss. In this, we uses enzymes, vitamins, hormones and growth factors, and we inject these ready-made injections into the scalps, and they help in improving hormonal imbalance, improve blood circulation and give essential nutrition to the hairs. Now the third treatment is low laser light therapy. In this, the laser light is used to stimulate epidermal cells of the hair follicles, and this low laser light therapy, this shifts the hair follicles into the growth phase. Now coming to fourth, iron supplements. Iron deficiency, it causes hair loss. So iron supplements in the oral formulation can be taken after consultation with a specialist. Now coming to anti-androgen medicines. Since PCOS in women, it causes hair thinning and hair loss. So only mesotherapy or PRP will not give desired results. So we have to take anti-androgen medicines to improve our results. So anti-androgen medicines, they stops the hair thinning and helps in achieving good results in our hair loss or in progressive hair thinning. Now coming to hair transplant. Hair transplant is a surgical procedure usually performed to treat baldness, and it is done by two techniques, FUE and FUT, and the choice of the technique depends upon the degree of hair loss and expected results. FUE is also called as follicular unit extraction, and FUT also called as follicular unit transplantation. Hair fall treatment at our clinic are very effective and helps in restoring self-confidence of an individual. So for any information and queries, please feel free to contact us. So stay tuned and thank you.